Xin kính chào các quý vị khán giả đang theo dõi chương trình trên trang fanpage của Cà phê sáng với VTV3. Không biết là sáng nay quý vị có dậy thật sớm và thưởng thức ly cà phê sáng.
Yes, good morning, ladies and gentlemen. I'm not sure coffee with the Good Morning program on VTV3. So we are live streaming a very important workshop on Grassroot Telemedicine Inception workshop. So this is an event being held in Hanoi. So we have a small questions to you. First, when you fall sick, mild ones only, what should you do? So we have three options to take. One, going to health facility. Second, to call your doctor. And three, go to pharmacy to buy medicines. Okay, so three options for you. First, A, visiting hospital for healthcare. Two, visiting and calling our close and friends and doctor for medication. And third one, going to pharmacy to buy medicine. So which one do you select, A, B, or C? So we would like to hear your response to see how are you going to react when you fall sick. Not serious one, okay, just mild illness. So when we have so many options, I think many people, particularly the one who are living in hard-to-reach area, they don't have the access, and sometimes, and many times, when they fall sick, they come to the consultation. But in some locations, consultations are located too far away from your residence. So what happened in the raining season? How can they access health facility? Okay, because many people are afraid of going far away, so that they can have a kind of self-medication. So when they come to the consultation, when their condition is so critical, then they are referred to higher levels. But transportation from common health station to higher level is not so easy at all, because that will affect a lot the health of the people as well. So that's the reason why the pilot for implementations of the Grassroot telemedicine in phase 2 amid COVID-19 pandemic is so important, because that we have to connect health workers from consultation to their colleagues from higher levels, so that we can improve the capacity and also improve quality of care at the grassroots level, particularly in the mountainous, hard-to-reach areas, and of course, the ethnic minority people and people with disability, because we want that no one is left behind. So in order to have better understanding about the process of implementing this solution, now we would like you to have a talk with Mr. V. Mạnh Cường, Deputy Director of the Department of Health of Bắc Cạn Province, one of the three beneficiaries provinces from the solution. So Mr. Cường, we know that Bắc Cạn has implemented the solution to connect health services across level in your province. So what was the reaction and what is your assessment on the result? Okay, we have been working and implementing the telemedicine at the grassroots level. We highly appreciate the work, because Bắc Cạn is a mountainous province. It's hard for the people to access to health facilities, so that's very chronic difficulty. And second thing, and during the social distancing periods, it also affected the healthcare service provision for us. So this grassroots telemedicine is so important and meaningful for the people, because during the COVID-19 pandemic, some patients were treated at the central hospital because of the lockdown and social distancing. So the hospital was blocked, and then doctor could not come to meet the patient in person. Then the common health station came to the patient's home. Then we also connected them via teleconference, then provide medical advice for them as well. So that is one of the motivation for the health sector to continue this grassroots telemedicine for better. So is there any story from the local people that had been, let's say, benefited from the solution? Can you elaborate more? Okay. During the process of providing telemedicine services, we provided consultation to a lot of patients, including cancer patients who are currently treated at home. And when because as the hospital like poor their service provision for a while, so they didn't know where to seek help, so they came to the community health station. And of course, the doctor from community health station could not provide the proper cancer treatment services, so we connected the patient with the national cancer hospital to get let's say technical and medical advice, so they feel it very easy to get the advice from the specialists, doctors. So can you yes, thank you very much for your storytelling. Thank you and for joining us in program. So in Bắc we also have two more provinces, Hà Giang and Lạng Sơn. So next we would like you to have a talk with Nguyễn Văn Giao, the acting director of Hà Giang Department of Health. So Excellency Mr. Giao, during the implementations of the grassroot telemedicine, what difficulty did you face during the implementation? Because later on, it is not no longer a pilot anymore, but that will be, let's say, mass replication. So what do you think? First, Hà Giang is a mountainous bordering province with very difficult geographical terrain. So the solution it's so good because however, most of the local people are ethnic minority. Then they have limited access to all types of services, while the IT infrastructures remain underdeveloped compared to other provinces. So it was very challenging for us to implement the IT solution, particularly telemedicine. So in your opinion, what should we do in order to make it more convenient and favorable? Because later on, not only Hà Giang and Bắc Cạn, but also that should be implemented in other provinces as well. I know that every beginning has its own challenges. So when it is implemented and the results are proven, then the people will proactively seek care, and of course, we have to improve ourselves, whatever we find that we are still weak at. For the grassroots level in our province, the ethnic minority people at the grassroots level are so many. So in order for the people to be fully aware of the system and be able to operate it and provide the best health services for the people, then trainings on IT should be provided to our local managers and operators. Thank you. So, okay, with the lesson learned from phase 1, pilot in 3 provinces of Lạng Giang, Bắc Cạn, and Hà Giang, then we need to develop further solutions so that we can have better grassroots and more effective grassroots telemedicine solution. Thank you very much for joining us. Okay, ladies and gentlemen, so after talk, I hope that you have understood to some extent the importance of having grassroots telemedicine system that have been jointly implemented by UNEP and the MOH, and we also expect that it will be proven effectively for the people health in general. Now we would like you to hear some information about a location where they are one of the beneficiaries of this system, a polyclinic in Hoàng Su Phi district of Hà Giang province. They are understaffed, only 1 doctor and 7 health workers only, and they don't have an even qualifications of medicine, and only 1 medical doctor is the head of the polyclinic. They provide about 20 patient visits per day, and give in the condition where they are located in the mountainous area, their medical works remain very challenging. So when the grassroots telemedicine were adopted, it also helped reduce referral to other facilities. Since early 2020 until now, very good information that among 1,000 visitors or patients, only 1 case were referred to higher level for further treatment. The remaining were completely treated and supported by the local polyclinics health workers through the telemedicine system. So attending the workshop today, we also welcome leader of the Ministries of Health and also leaders from all 63 provincial health departments who are attending the workshop virtually. Now, I would like to invite you to come to the main sessions of the workshop. Thank you. Please stay tuned. So, we welcome all delegates to the Grassroot Telemedicine Inception workshop. Doctors for the family. This is an event jointly organized by UNDP and the Electronics Health Administration Ministries of Health. Ladies and gentlemen, amid COVID-19 pandemic, healthcare services are encouraged to be provided through telemedicine in order to prevent infection. However, differences in quality and capacity in providing care across level remain large, and while higher level facilities are overcrowded, while the lower level facility have very few patients. So with the support and interest by the party and government, and based on the general's IT platform, in particular, the telemedicines had been developed. In particular, it was provided amid COVID-19 pandemic, and particularly it's very helpful for patients with comorbidity and those who could not move far away. Within the framework of responding to COVID-19, UNDP had developed a digitalized platform that provides consultations and health examination from remote that will make to the joint efforts of the MOH in improving quality of care at the grassroots level towards the universal health coverage, particularly the ethnic minority people and those who are with disability and have limited access to healthcare facilities. This is also in line with the Vietnam's digital transformations orientations in particular. So attending the workshop today, we would like to introduce Mr. Do Xuân Tuyên, Vice Minister of Ministries of Health, and Mr. Patrick Haverman, Deputy Resident Representative of UNDP in Vietnam. And we also welcome experts from UNDP in Vietnam, leaders and staff from 63 provincial health departments who are attending virtually, and also health workers, media agency, delegates, participants, and also audience who are watching the event through the live stream. Okay, in order to begin the workshop, we would like to invite Dr. Do Xuân Tuyên, Vice Minister of Health, to take the floor and deliver the opening remark to the workshop. So welcome. Mr. Patrick Haverman, Deputy Resident Representative of UNDP in Vietnam, representatives, international participants, and national delegates, colleagues and friends, and participants from all provinces. Today, the Ministries of Health work in partnership and cooperation with UNDP to organize a Grassroot Telemedicine Inception workshop, phase 2. So on behalf of the Ministries of Health leadership, I warmly welcome UNDP experts, participants, and audience for your time attending the workshop, and we wish you a very successful event. Ladies and gentlemen, in the past year, with the interests and direction from the state party and the facilitation from central ministries and sectors and coordinations of local authorities and effort from the health sector and the support and cooperation from international friends, the applications of digital transformation had been implemented, and we have gained certain and in very encouraging outputs. The Ministries of Health had issued many legal documents that complete the legal framework to adopt IT platform in the health sector. A successful implementation and effective implementations of electronic public services in the health sector. On 30th of June 2020, we completed 100% public service at level 4 that had been assigned by the government, and launching the health portal as the main web portal for business and people to seek information about the prices of medical equipment, commodity prices, bidding services, and information about the prices of the products available in the market, and also some information about the advertising. MOH had worked with the Vietnam Social Security to implement an interoperable connection between the health facilities and provincial health securities agency. Now, over 1,000 health facilities had been connected through this system. So IT applications had been developed well. 100% of hospitals having the hospital management information software. 20 hospitals had successfully implemented the electronic medical record system. 23 hospitals had implemented the storage and transmissions of image instead of the paper-based system. Develop a telemedicine and link its internet of everything. The MOH issued decision 2628 in 2020 approving the proposal on telemedicine during 2020 and 2025. At present, over 5,000 health facilities are linked and using telemedicine. The Ministries of Health had worked in close collaboration with the Ministries of Information and other local agencies to overcome the challenges in order to implement a timely synchronized program that are also timely amidst COVID-19's response. So, ladies and gentlemen, amid COVID-19 and the Industrial Revolution 4.0, UNDP in Vietnam had worked with the Electronic Health Administration of the Ministry of Health and the departments of Bắc Cạn, Hà Giang, and Lào Cai to pilot the Grassroot telemedicine software that link health workers at community health station with the local people in mountainous, hard-to-reach areas, including ethnic minorities and also people with disability, with the purpose to leave no one behind. Through the expert assessment and local authority, the implementation of this telemedicine solution at the grassroots level had brought about very encouraging results. It was welcomed by the local health authority and also highly appreciated by the local people. And the local people are provided with medical care by local health workers with the consultation from higher level facility. Based on the initial successful work, the UNDP in Vietnam had worked in collaboration with the MOH to continue phase 2 to replicate the application of the system to improve the capacity of health workers in 3 provinces until June 2022. The implementation of the telemedicine it's completely in line with the direction of the Ministries of Health, particularly when we are now preventing against COVID-19, and the telemedicine is the right approach for us because it brings the quality service to local people through the consultation from experts from higher level, but also help us to prevent from COVID-19 as well. So in order to implement the program successfully, I would like to request first the EHA is the focal point to continue working with UNDP and DOH, Hà Giang, Bắc Cạn, and Lào Cai to develop action plan and develop work plan to implement this telemedicine solution in the grassroots level. Two, the health insurance department of the MOH is the focal point to work with the EHA, to work with the maternal and child health department, and also the provincial social security to provide reimbursable services when the services are covered by telemedicine, when the prescriptions are made by local doctor with consultation from higher level. Number three, we would like to request the UNAP to work closely with the Electronic Health Administration so that we can implement timely this telemedicine software effectively in provinces of Hà Giang, Bắc Cạn, and Lạng Sơn, so that will lay the foundation for the national replication. Four, the departments of Bắc Cạn, Lạng Sơn, and Lào Cai work closely with the UNDP to implement this grassroots telemedicine solution throughout the provinces so that we can improve better access to better high quality services for the local people. So ladies and gentlemen, at this workshop on behalf of MOH leadership, we would like to express our sincere thanks to UNDP in Vietnam, and we look forward to further and stronger support from UNDP and international community in the course of care, protection, and improvements of people's health, and particularly in the context of health digital transformation. Once again, we would like to wish Mr. Patrick and also the head of residence representative of UNDP in Vietnam very good health, and we wish you a very successful workshop. Thank you very much. Thank you, Mr. Đỗ Xuân Tuyên, the Vice Minister of Health, for the opening remark. Next, we would like to invite Mr. Patrick Haverman, Deputy Resident Representative of UNDP in Vietnam, to have some reflections from UNDP. So yes, please, the floor is over to you, Patrick. Kính thưa ông Đỗ Xuân Tuyên, Thứ trưởng Bộ Y tế. Vâng, xin trân trọng cảm ơn ông về cái phần phát biểu khai mạc vừa rồi. Kính thưa ông Nguyễn Trường Nam, Phó Cục trưởng Cục Công nghệ Thông tin. Kính thưa các đại diện là của các cơ quan, quý vị đại biểu. Rất là vinh dự cho tôi khi được phát biểu trong cái hội thảo ngày hôm nay về giải pháp tư vấn khám chữa bệnh từ xa tại tuyến y tế cơ sở. Đầu tiên thì xin được chúc mừng chính phủ Việt Nam và đặc biệt là hệ thống y tế về cái khả năng đáp ứng quốc gia trước đại dịch Covid-19, trong đó có việc là phòng chống cái việc bùng phát và nhân rộng các cái chương trình tiêm chủng trên toàn quốc. Điều này cũng đã tạo ra một cái cơ sở cho chúng ta để có được tình trạng mới. Cũng xin được chúc mừng Bộ Y tế đã triển khai thành công chương trình khám chữa bệnh từ
on the 25th of September 2020, which contributed to the implementation of the National Digital Transformation Program that the Prime Minister has directed. UNDP is proud in working with the government, the Minister of Health, and the national and international partners, and especially the government of Japan, to support Vietnam's response to COVID-19 under the dual objectives
chuyển đổi số quốc gia của Việt Nam đến năm 2025 và tầm nhìn 2030, bao gồm chuyển đổi số trong y tế và gần đây
robots to protect the frontline healthcare workers from COVID-19. UNDP also supported a production and dissemination of communication materials in ethnic minority languages. We supported the promotion of national production of PPEs, the development of a PPE inventory system, and the purchase of 10 PCR devices on behalf of the Vietnam administration for HIV/AIDS control. UNDP is also following up on other requests from the Minister of Health regarding the support to health procurement, using our long-term agreements of the United Nations system, and support to COVID-19 vaccination production, and to support the development of a climate-smart healthcare system in the context of climate change. The National Telehealth Program enables the connection and improved health services at national and provincial level. However, one of the important questions is how grassroots level health services can be improved. Since December 2020, UNDP has cooperated closely with the Electronic Health Administration of the Minister of Health and with the provinces of Ha Giang, Bac Can and Lang Song to develop and pilot the digital solution focusing on grassroots health facilities to connect healthcare workers and commune health stations with local people in remote and mountainous areas, including ethnic minorities and the people with disabilities, with a focus of leaving no one behind. The digital solutions include a secure video conferencing platform for higher levels to provide consultation and guidance to commune doctors, for multi-point calls to support regular meetings between district health centers, district general hospitals and commune health stations. The UNDP also provided technical assistance to the Electronic Health Administration to develop information technology criteria for implementing remote health activities and to strengthen communication capacity in the field of information technology. Building on this initial success, to continue furthering digital transformation of health in the COVID-19 and the Industrial Revolution 4.0 context, UNDP is currently supporting the second phase of the Grassroot Telehealth program from April 2021 to June 2022, focusing on strengthening capacity for digitalization of health services at grassroots level and scaling up the Grassroots digital health platform, connecting commune health stations, people and higher level healthcare facilities in these 3 provinces, and sharing the model and the results of piloting with other provinces nationwide. In the future, we hope to provide further support to replicate the model in further provinces with the ultimate aim of supporting the development of a nationwide grassroots health system. On 24th October, during the working meeting with several provinces on COVID-19 prevention and control, the Prime Minister Pham Minh Chinh emphasized the need to focus on upgrading and strengthening the capacity of health systems at all levels, especially the capacity of the grassroots healthcare system at the commune level for early detection and treatment, including the use of telehealth. The system piloted by UNDP and the Electronic Health Administration in 3 remote and mountainous provinces is very suitable to meet the strategic priorities in both health digitalization and strengthening grassroots health systems. Building on our close and successful long-term cooperation and emphasizing the importance and necessity of the government's strategic directions on digital transformation of health and capacity building for grassroots healthcare systems, UNDP looks forward to continually strengthening our strategic partnership and cooperation with the Minister of Health, contributing to the development of the health sector in Vietnam and particular focus on healthcare systems at the grassroots level. I'm confident that working together, our joint efforts will contribute to a more resilient and prosperous country where no one is left behind. Xin cảm ơn. Thank you.
Thank you, Mr. Patrick Havermans, the Deputy Representative of UNDP in Vietnam. So now we would like all of you to look at the screen to watch demonstrations of telemedicine that was developed by the communication units of UNDP.
Vượt qua chặng đường gần 10 cây số từ thôn Kết Thành, chị Lý Thị Hoa được chồng đưa tới phòng khám đa khoa khu vực Nam Dịch để khám cấp cứu trong tình trạng hoa mắt, chóng mặt và mệt mỏi. Các cán bộ y tế của phòng khám ngay lập tức tiến hành khám lâm sàng, kiểm tra tình trạng sức khỏe của bệnh nhân. Khi thấy có những khúc mắc trong vấn đề chuyên môn, trưởng trạm y tế đã liên hệ kết nối để có sự tư vấn của các bác sĩ bệnh viện đa khoa huyện Hoàng Su Phi. Dựa trên các dấu hiệu lâm sàng cùng với sự tư vấn kịp thời của các bác sĩ tuyến trên, bệnh nhân được sơ cấp cứu ngay tại chỗ mà không phải chuyển lên tuyến trên điều trị. Là người dân tộc Dao, quanh năm sinh sống trên núi cao, lại không có nhiều kiến thức về y tế. Biết mình được ở lại điều trị tại phòng khám đa khoa khu vực Nậm Dịch, chị Hoa mừng lắm.
Sáng nay tôi bị mệt, chóng mặt, hoa mắt, đi không được. Chồng tôi đưa lên phòng khám để cấp cứu. Trước kia nhà tôi cũng có người bị cấp cứu, đưa vào bệnh viện huyện xa mà vất vả lắm. Hôm nay đến đây khám, được bác sĩ ở xã khám, rồi có cả bác sĩ ở huyện nói chuyện, hỏi thăm và động viên để tôi yên tâm ở lại đây điều trị. Tôi rất là cảm ơn các bác sĩ.
Phòng khám đa khoa khu vực Nậm Dịch quản lý công tác khám chữa bệnh cho 5 xã trên địa bàn với nguồn nhân lực rất hạn chế, chỉ bao gồm 1 bác sĩ và 7 nhân viên y tế. Trình độ chuyên môn của các cán bộ cũng không đồng đều. Mọi hoạt động chuyên môn chỉ trông cậy vào duy nhất bác sĩ trưởng phòng khám. Với việc khám và điều trị trung bình khoảng 18 người bệnh mỗi ngày, khi gặp phải những ca bệnh nặng, với địa hình núi non hiểm trở, công tác chuyển tuyến cũng hết sức khó khăn. Việc triển khai hệ thống tư vấn khám chữa bệnh từ xa với sự hỗ trợ chuyên môn của các bác sĩ tại Bệnh viện Đa khoa huyện Hoàng Su Phi đã cải thiện đáng kể tình trạng chuyển tuyến. Tính từ đầu năm 2021, trong số khoảng 1.000 bệnh nhân tới khám, mới chỉ có 1 ca phải chuyển lên tuyến trên điều trị.
Đường xá đi lại cũng như địa hình của người dân ở đây rất là phức tạp, cho nên là đến cơ sở khám chữa bệnh nhiều khi chúng tôi chuyển tuyến cũng vậy thì cũng rất là bất cập vì là hệ thống đường xã nó đi lại khó. Từ khi mà có cái khám chữa bệnh hỗ trợ từ tuyến trên trở xuống ấy thì tôi thấy là cũng rất là bổ ích, bởi vì cho hệ bác sĩ tuyến xã như tôi, bởi vì là bây giờ nếu gặp những trường hợp cấp cứu khó khăn chúng tôi chưa nhiều cái thì cũng không thể biết hết được. Muốn cần sự hỗ trợ chúng tôi chỉ cần vào cái hệ thống mà kết nối với lại chỗ tuyến trên thì chúng tôi đã được sự hỗ trợ của tuyến trên là giúp đỡ cho bệnh nhân là qua khỏi những cái vấn đề cấp cứu.
Hệ thống tư vấn khám chữa bệnh từ xa tại tuyến y tế cơ sở được thực hiện để kết nối bác sĩ tại xã với bác sĩ bệnh viện tuyến trên để tư vấn khám chữa bệnh từ xa cho người bệnh tại trạm y tế. Với sự hỗ trợ của chương trình phát triển Liên Hợp Quốc UNDP, Cục Công nghệ Thông tin Bộ Y tế đã triển khai thí điểm hệ thống tư vấn khám chữa bệnh từ xa tại tuyến y tế cơ sở tại 3 huyện thuộc 3 tỉnh miền núi đặc biệt khó khăn là Hoàng Su Phi, Hà Giang, Cao Lộc, Lạng Sơn và Ba Bể, Bắc Kạn, với tổng số 60 xã, thị trấn. Tổ chức tập huấn cho tất cả các cán bộ y tế xã tham gia chương trình tại 3 tỉnh những kiến thức căn bản. Các cán bộ y tế xã sau khi được tập huấn đã trực tiếp thao tác và sử dụng hệ thống, kết nối thường xuyên vào hệ thống để phục vụ cho nhu cầu công việc. Bệnh viện Đa khoa huyện Hoàng Su Phi, một trong 3 huyện được lựa chọn thí điểm hệ thống, đã chủ động thành lập nhóm hỗ trợ chuyên môn gồm 19 thành viên là các bác sĩ thuộc trung tâm y tế huyện và các bác sĩ chuyên khoa tại bệnh viện. Với sự hỗ trợ nhiệt tình của nhóm chuyên môn, việc tư vấn điều trị và xử trí những ca cấp cứu thông thường tại tuyến xã đã được giải quyết căn bản.
Khi một xã có cách trung tâm thị trấn khoảng 10 cây số thì để khi mà vận chuyển được bệnh nhân ra đến ngoài này thì mất cả hơn 1 tiếng đồng hồ. Khi mà cán bộ y tế cơ sở gọi là chúng tôi có thể tư vấn, thậm chí hướng dẫn cho y tế cơ sở cần phải làm gì trước khi chuyển về đây. Thì trong quá trình chuyển về đây thì cái cơ bản sơ cứu ban đầu nó đúng ấy, thì khi chuyển về đến chúng tôi ở đây ấy, thì cái bước xử lý tiếp theo thì sẽ thuận lợi hơn rất nhiều.
Mô hình thí điểm hệ thống tư vấn khám chữa bệnh từ xa tại tuyến y tế cơ sở bước đầu triển khai thí điểm đã mang lại những hiệu quả rất đáng khích lệ. Tỷ lệ người dân chuyển tuyến đã giảm so với trước kia. Tuy vậy, qua thực tế triển khai, những vướng mắc về cơ chế chính sách cho người tham gia khám, tư vấn cũng như cơ chế phối hợp giữa các thành viên và giữa tuyến trên với tuyến dưới vẫn còn tồn tại và cần được hoàn thiện.
trong khi các xã đều truy cập hệ thống ấy, thì rất là nhiều thông tin đến với chúng tôi, thì bộ phận hệ thống ấy thì là đôi khi là chưa phân loại được, là chưa liên hệ được các bác sĩ theo đúng chuyên ngành để đáp ứng và trả lời cũng như là hỗ trợ cho từng đơn vị tuyến y tế cơ sở một.
Phải có cái sự đầu tư để tập huấn thường xuyên nhân nâng cao trình độ cho tại cán bộ trạm y tế và đặc biệt là cái tổ tư vấn khám chữa bệnh từ xa ở tuyến huyện. Cần có cái cơ chế chính sách là hỗ trợ cho các bác sĩ mà thực hiện cái công tác tư vấn cho tuyến xã.
Lợi ích của hệ thống tư vấn khám chữa bệnh từ xa tại tuyến y tế cơ sở được đánh giá là cần thiết và phù hợp với các địa phương miền núi, vùng sâu, vùng xa, địa hình hiểm trở, đi lại khó khăn, giúp người dân có thể thụ hưởng các dịch vụ y tế có chất lượng tại chỗ, tránh tình trạng phải chuyển tuyến vất vả với rất nhiều những chi phí phát sinh và nguy cơ lây lan dịch bệnh.
Được sự hỗ trợ của Bộ Y tế thì Hà Giang được thí điểm cái chương trình khám chữa bệnh từ xa đối với lại tuyến xã, đặc biệt là quản lý các bệnh mãn tính. Trên nền tảng cái công nghệ thông tin thì chúng tôi cũng hy vọng trong thời gian tới là các cán bộ của trạm y tế xã được hỗ trợ về chuyên môn, nâng cao được cái hiệu quả, chất lượng khám chữa bệnh tại tuyến cơ sở và người dân không phải đi lại xa mà vẫn hưởng được cái chất lượng khám chữa bệnh chất lượng cao.
Grassroots doctors, although who are in hard-to-reach areas, can use it then to organize health professional teleconference with other level facility at the district, provincial, and even major cities, so that they are all well connected to provide the medical counseling and treatment for doctors at the grassroots level. Right, very simple. Just a mobile phone, then you are well connected to the healthcare system to receive medical advice, and then people can immediately receive medical advice from doctors. That can help reduce overcrowding at health facilities at high level, and also help improve quality of care and capacity for doctors at lower level facilities. Attending the workshop today, I would like to introduce Dr. Nguyễn Thanh Hoa. She's an UNEP expert to make presentations on the effectiveness of grassroots telemedicine. So the floor is over to you, Dr. Ha. Yes, good morning, Vice Minister Tuyên. Mr. Patrick Haverman, the Deputy Resident Representative of UNDP in Vietnam, representatives from the Provincial Health Department, local health authority who are attending the conference physically and also who are attending it virtually. So let me say on behalf of the UNDP staff, I just want to make a very quick presentation on the project named Bác sĩ cho mọi nhà, means doctors for the family, using the Grassroot telemedicine. So I hope that people can see it on my Vietnamese version presentation. Amid the IR 4.0, UNDP is supporting Vietnam on the national digital transformation in health to 2025 and vision to 2030. Since December 2020, UNDP works closely with the Electronic Health Administration to develop and pilot a digital platform with a focus on supporting the grassroots health level, in which we also work with the EHA to select 3 mountainous remote provinces where they have the biggest transportation conditions. They are also poor provinces, so that can be implementing the pilot we call Doctor for Everyone, a software to improve the institutional capacity for the grassroots level. This is a software, this is a web-based software, can be used on smartphone, and it was developed with a view to have a friendly user features for people with disability and also ethnic minority people and people who are living in hard to reach areas. The application can connect video conference calls with dual objective: one, connecting community health workers with the local people in order to disseminate health information and providing health services from remote. Second, people can log in the app to set up an appointment with doctor to reduce waiting time and travel time, because without setting up the appointment, it may lead up to overcrowding at health facilities, and sometimes when the patient visits not in the appointed time, then they may not see their doctor of their interest. And the second, the community health workers can be connected with higher level doctors, particularly during the pilot periods. We were able to connect community worker doctors and doctors from the district health centers, because the district health center is the administrators of the community health station. The benefits of the program is to increase people access to healthcare services particularly amid COVID-19 pandemic, and also disease prevention measures, and also to bring better quality consultations, treatment and services for the people. Second, it aims to reduce the time where people have to spend traveling from their home to the facility. You know that those 3 provinces had very difficult transportation conditions. So when we have a platform that can help connect common doctors with the people, then it's very convenient for the people, because that will bring the services to where people live and work. And the third benefit is that it will help to improve the professional capacity by organizing joint consultation or providing medical advice by experts from higher level to the community health workers, particularly during the context of social distancing and other COVID-19 prevention measures. It also helps provide better and more timely service provision to the people. And the fourth benefit is that it will help reduce the overcrowding at the higher level facilities. In relation to the current features, for patients, they can create and they, for example, like appointment with doctors, and second, they can have conversation with a doctor through the free text message system of the app. Third one, they can also see notice or disseminations of information on health communication. There are also some features when they receive information on their appointment, then the common workers can receive the appointment, then verify with the patient to see them in appropriate time, so that the service can be provided to the patient. They also help set priority in case the patient need immediate care. Another feature at Common Health Station is that to make a prescription. However, this feature do not have the needs for using, because they have their own management software at Common Health Station already. So we support this feature. Another function is that they can make a video call to higher level health facilities. So as you watch the video clip some minutes later, for example, polyclinics in Namzik's district, they were connected with the district health center of Hoàng Su Phi, where technical advice was provided to them. In Bắc Cạn, we also know that Ba Bể district health center had regular meeting with common health station within their district during the pilot using this app. And they can also update notice or information about health in general. The district health center can also make a video call to their common health stations, so it's got a multi-point call, and they can also get updated comments on the paper for common health station, either kind of professional support, and also see updated information on health notice. For local health system, it can help manage like item for use or users, or post health messages for different levels, including the health facilities and also the public. Given the functionality and the software that had been developed, then UNDP, with support from the Japanese government, we conducted phase 1 project already. Now I just want to share with you the results from phase 1 when it was piloted. It is a digital health platform that you have been seeing from the video clip already, and the second, it's a kind of training manuals for using the Grassroot telemedicine. So it was developed, and the training was provided on using the manual was also provided as well. They can use the web-based or smartphone to get training. In which 60 common health stations of the most challenging districts of the 3 provinces, they had very difficult transport system. For me, I was there already. It took me a lot of time from the district center to the commune, so it took full day to go from the district center to the commune. So that was because we were traveling by car, But what would happen if people have to go to the facility on foot or other means of transportation? So 3 districts, Hoàng Su Phi of Hà Giang province, Ba Bể of Bắc Cạn, and Khao Lộc of Lạng Sơn province are piloting, in which 153 health workers were trained and 84 health workers are men, 69 are women or female, and particularly 131 health workers who are ethnic minority, including Tây, Nung, Giao, La Chí, and so on. 38 health workers are district staff, 138 commune health workers, and particularly 110 village health workers. They are an extension for communication to outreach to the people in the community. The software were installed to laptop, computer, or smartphones at the pilot health facilities and also trained health workers. And it was piloted successfully in 3 communes, and we were able to connect successfully at 3 communes. Bản Phùng commune health stations, they were connected with their district health center, and the other Ba Mẫu to the other district, Ba Bể, and also the Sa Cư commune health station were connected to Gia Lộc district health center. So the app helped regular meeting and also provided the advice, particularly amid COVID-19. At the Ba Bể district health center and Ba Bể district health center, local district leadership decided to set up a professional task force that can provide support for their local community health stations. So it's reflected a very high level of commitment of the local leadership. So that was the initial results of phase 1. So with the support from the Japanese government, we have been working with the Electronic Health Administration to continue with phase 2. So we have a follow-up funding to implement phase 2, and in this phase 2, it was started in June 2021 until June 2022. We work in collaboration with EHA to develop action plans and activities. Number 1, to upgrade the software to cover all the functionality, at least in 3 districts, 3 provinces. And we also expect that in order to do it, we need to make greater efforts so that we can replicate it at the province-wide and also at nationwide. And the second point, in order to implement the program, we have also procured and handed over 2 servers to the Ministries of Health. It was installed and located at the data centers of the Ministries of Health in order to implement the program and also store health data to assure health information's confidentiality. Because at present, quite a lot of health workers using very popular platforms like messages on Facebook or on Zalo. But now we have a server in the country, because for those social media, the servers are located outside of the country, and so it may not secure the information's confidentiality and also privacy. So the servers were located right inside the Ministries of Health, and then it can store the information and data for the program's activities. We also have an introduction of the software to 63 provinces. Actually, this is the event where we can introduce it to all provinces. This is so important for the local health authority and also health workers, participants from different points. If you are interested in and if you have the opportunity to implement the software earlier than the schedule, then you can contact the electronic health administrations or UNAP so that we can provide timely technical support for you. Another activities in phase 2 is that UNDP will work closely with the EHA and the departments of health of 3 provinces, Hà Giang, Bắc Cạn and Lạng Sơn, so that we all can implement it in all facilities in those 3 provinces. As I said earlier, we just had some initial results of the phase 1 program only. So at the end of phase 2, we will have an evaluation for both phase 1 and phase 2 as well. Then we will put it in a consolidated report, which includes recommendation for further replications to other provinces or nationwide. So in order to continue the program and make it more effective, it is expected that we will develop programs or plan that will continue after phase 2. For immediate future, we have Korean-Vietnam Peace Village project funded by the Korean government, in which there are many activities including setting up a functional unit on telemedicine in community health stations. In some central region provinces of Vietnam where the mine clearance is done already, and we are now also drafting this proposal, and we hope that we can get more funding from other donors so that we can implement it at larger scale as well. So that's the end from my presentation on the project of developing the grassroots telemedicine platform that can support the grassroots level facility. We thank you very much for your listening. Thank you, Dr. Thanh Hà, UNDP expert, for very useful sharing. Next, we would like to invite Ministry of Health representative, Dr. Đỗ Xuân Tiên and Mr. Nguyễn Trường Nam, the Deputy Director of EHA. And we also would like to invite Mr. Patrick from UNDP and Mr. Đào Xuân Lai, the heads of Climate Change and Environment Unit from UNDP. Please come to the stage to receive the handover of the doctor for everyone's server. So welcome all the participants, and please come to the stage to have a token hand over the software. So a round of applause to congratulate this event. Thank you very much, representative from MOH, representative from UNDP. Yes, ladies and gentlemen, the Doctors for Everyone software had been handed over to the Ministries of Health, and we also hope that this grassroots telemedicine software will be applied widely, not only in the pilot location but also to other provinces so that we can improve better healthcare for the people throughout the country. So, ladies and gentlemen, that's the end of the first session. Now we would like to invite you to take a short coffee break before we resume for further discussion. Thank you.
Cho mọi nhà giai đoạn 2 và qua những chia sẻ của đại diện Bộ Y tế cũng như là chia sẻ của đại diện UNDP thì chúng ta đã thấy được hiệu quả của giải pháp này như thế nào. Và bản thân chúng tôi trên trang livestream của chúng tôi cũng đã thấy rất nhiều các quý vị khán giả comment về sự hữu ích của giải pháp. Bản thân quý vị cũng thấy điều đó đúng không ạ? Và khi chúng tôi thực hiện buổi livestream này thì chúng tôi cũng rất mong rằng quý vị khán giả chúng ta sẽ cùng thực hiện một động tác rất đơn giản thôi, đó là chia sẻ lại livestream hoặc chỉ đơn giản là một vài câu trích dẫn trên trang Facebook của mình, hoặc là chia sẻ trực tiếp với những người thân hay là gia đình, những người quen mà quý vị biết, những người đang ở những nơi khó khăn, những người đang ở vùng sâu.